through the implementation of Kids Help Phone's Indigenous Youth Action Plan in partnership with Indigenous peoples from coast to coast to coast. So please allow me, since I actually have the podium, to expand on this acknowledgement with a personal reflection. Yesterday, I spent the morning with Elder Bev in Winnipeg, along with my fellow directors on the board of the Mental Health Commission of Canada. We gathered in the circle and our hearts and souls were opened with a smudge. Then Elder shared her story of generational trauma in her journey of healing, which is far from complete, as she would say. She would also say that there can be no healing without truth and no reconciliation without healing. I felt her incredible strength through her vulnerability. I left the circle stronger. I left the circle with a greater resolve as a settler to learn, to unlearn, to learn again, and to do my part for the Indigenous people of Turtle Island for truth, for healing, and for reconciliation. And Kids Help Phone has a significant real role to play in this journey. We are the only 24/7 bilingual, multilingual actually, national youth e-mental health solution in Canada. We are the pioneers in virtual care and have been doing this work for more than 33 years. Imagine a Canada without Kids Help Phone. As a grateful parent, I cannot. And then, we all know, a pandemic shut down an entire globe. Imagine Canada in the last 32 months without Kids Help Phone. I cannot imagine. But I do want to step back from the pandemic for just a moment. And I always want to remind all of us that there was actually a mental health crisis in this country for youth pre-pandemic. Pre-COVID, the second leading cause of death for young people in Canada was suicide. It still is. Pre-COVID, Canada has the third highest youth suicide rate in the industrialized world, in Canada. As someone myself who lived outside of Canada in a third world developing country in the past, I find that staggering, Canada. And then there was the pandemic, and we all know the incredible impact that the pandemic has had on all our mental health, but on youth and mental health in specific. Isolation, fear, grief, self-image, lost milestones, depression, anxiety, suicide, and suicide ideation. And Kids Help Phone was there. We did not go dark, not for 1 second. In fact, we expanded services. We brought new programs online. And with wait times that average around 5 minutes, 24/7. Quality scores that remain excellent, a testimonial to the courage of our frontline. More than 70% of young people reaching out to us tell us something they have never told anyone before: immediate impact. More than 85% say they feel better, they feel heard, that the next step can be taken, whether that might be just taking a breath or getting some sleep, a smile, or getting to the next morning. Immediate impact. As Kids Help Phone CEO 31 months ago, I think, in March of 2020, I was deeply worried. I was worried about our staff and keeping them safe. I was worried about keeping our service 24/7 in both official languages in every corner of the country. And I was worried about weathering the financial storm that was in front of us as a not-for-profit charity. And that is where I want to say thank you to the Government of Canada. 6 weeks into the pandemic, the Prime Minister announced financial support for Kids Help Phone. And because of that, we are able to keep doing our work and scaling and scaling and scaling some more. And the rest of Canada galvanized as well. Crisis responders are frontline of the texting platform, volunteers in every corner of Canada. We trained more than 7,000 crisis responders. They shored up the youth of Canada. And donors across Canada also decided, as a charity of choice, Kids Help Phone needed to be shored up. So because of that support, I'm so proud to say, also because of our courageous frontline and our staff, we have interacted with young people more than 12 million times since March of 2020. That, my friends, is a silver lining. Here's the thing though, with a mental health care system that is hard to maneuver, and dare I say, with some systemic fracture, we have a mental health gap in Canada, a gap that Indigenous young people, Black young people, youth of color, racialized and or marginalized young people experience every single day. And the pandemic has made that gap much wider. And young people, these young people are potentially and are falling through the gap. Equity deserving, equity seeking populations deserve just that, equity. Real equity, meeting their needs where they are, how they need it, how they want mental health service. Social injustice is in fact a determinant of mental health. We know this at Kids Help Phone because young people tell us this every single day. Our data is very clear. Some of our most distressed texters we get second only to those that fear imminent harm in their own home are those that experience racism and discrimination. And those that speak about racism and discrimination are most likely to also talk about suicide. So today is about equity. Thanksgiving could not be a better time to reinforce that line in the sand that there must be equity in the mental health for the young people of Canada, that Black youth, Indigenous youth, newcomers to Canada, youth of color, LGBTQ2S+ youth, they must have equity. Young people, Canada, equity is about today. So with that, I am so delighted to welcome Minister Bennett here today to the podium. This minister has been a trailblazer for many years, long before she became a member of Parliament or a cabinet minister, for women's health as a family practitioner doc and at Women's College Hospital, a tireless worker, a real worker as a public servant for Indigenous people, for population health, for mental health, for equity, for the people of Canada. So Minister Bennett, thank you for being here today.
Well, thank you, Kathy. And even if there wasn't an announcement, I'd be pleased to be here just for everybody to hear the story of Kids Help Phone and for us to have this opportunity to let Canadians know really what you do and what you do so well. And I hope that, yes, no, I think that our relationship back at Women's has been important, but I think that all of you know that actually my job as a family doctor wasn't any different. You ask what's wrong, you listen, and together you make a plan. And I think that it's the listening part, I think that is the equity part, that when people don't feel they've been listened to or they don't feel safe accessing help, that it really gets in the way of people getting the care they need. And so I too want to acknowledge that we're gathered on the traditional territory of the Mississaugas of the Credit, where we, of course, honor all of the Indigenous peoples who moccasins walk these lands and who paddle these waters. I always think that the land acknowledgement, like you did, Kathy, has to come with a little bit of context. And I think that what we know in terms of the medicine wheel and keeping people well not just patching them up when they get sick, to be able to find that balance of mental, physical, emotional, spiritual, that lets us know that mental health is health. Spiritual health is health, the emotional health is health, and that we actually have to work very hard on this. But the other teachings I think that are really important today are, I think we learned that as we look today, we should listen to strong women, and I think that when you Kathy and Tamara, Deanna, Alyssa, that this is a good idea that came, and that the first wave of feminism actually came from the Haudenosaunee women in northeastern United States who taught those first wave of feminists what they should be asking for, and it wasn't just a little bit along the side. And so, but also I think that what we learned through COVID is protecting our elders, and being able to understand that the wisdom that we need to tap into. But today, I think the teaching that is the most relevant is that if you put children first, you will get good policy on just about everything. And so I think that, what we're celebrating today at Kids Health Phone, and to be here at your amazing headquarters, is that what you've been doing for 33 years, in some ways, COVID accelerated that. What has been happening for kids needed to happen for grown-ups too, and that somehow COVID has sort of crystallized our idea that if you didn't exist, somebody would have had to invent you in the last little while, and yet you stepped up with 33 years of experience, knowing what works and what doesn't work, who needs your services, who is, as we learned on the under overrepresentation in the calls from the Indigenous and Black community, even though we feel they're underrepresented sometimes in getting in-person care. And so that this is I think that as you say, gap is what we need to do. And so it is, I think, hugely important that Canadians understand that it's there. I think the brand is so strong that kids know it's there, and I think that somehow we, that what in learning about a little bit your counselors in the classroom, that the idea that whether it's grade 1, grade 4 or 5, that kids come to understand that there are resources in them, understanding they don't have to be alone, they don't have to feel alone if they don't, and it's okay to not feel okay. So I think that you have, and I think the data that you have is so clear in how we're going to chart a path forward on making mental health a full and equal part of any sort of health strategy. And so it means that we need to know what people are talking about, what they're feeling, and how do we go forward in terms of from grief versus depression to stress versus a real anxiety state, for kids to be able to name what it is they're feeling, and then be able to seek help for themselves, or as we've learned on the tour, for a family member that they're worrying about. So it is that you have figured out how to do whatever it takes. And I was really impressed with what you'd said about whether it's food security or other challenges, that the ability of Kids Health Phone to actually tap into the other services, the wraparound services that kids might need on the call is, and particularly the counseling, but the ongoing supports. I think that young people, and as you said, Kathy, Indigenous, BIPOC, newcomer, children with disabilities, the 2S LGBTQIA+, have been underserved before the pandemic, are still underserved. But we hope that today we're going to be able to just ramp up that care online or texting as we mark the end of Mental Illness Awareness Week. This is, I think we're finishing the week with huge hope and inspiration to be able to make this a part of every Canadian's commitment, to know that there are people there that know, and the humility that we all have to feel. There was a conversation on CBC where, people saying what not to say, to not say, at least it's not this. And you're going, like, please don't, like, to actually be able to say, I don't have the words, I don't know what to say. We can teach people these things. We can teach people how to establish rapport about, you look happy, you look sad, you look like. There is a mental health literacy that we are going to have to achieve as a baseline if we're going to be able to make sure that no one's left behind and that people notice when somebody's not themselves today. So I do think through COVID, and as we've said, that with this unprecedented shared challenge, that maybe it was a little bit easier for people to admit that they were struggling. Maybe it was a little bit easier for them to be able to express to somebody that they were a little bit worried about, numbing themselves out with more substances or alcohol. I think that it seemed shared. And I think that as people have been more able to discuss it, maybe we've begun to take that stigma down in terms of people being able to talk about their emotions and their feelings and their mental health or their mental illness. And I think this week we're trying to explain the difference, that we all want to aspire to good mental health. But I think in what Dr. Kuchar did for the parliamentary handbook, that anybody who wants to look at, that some people with mental illness may have better mental health because they actually have recognized their mental illness and are coping in a very healthy way with their diagnosis. So I think that we all know what happened with the isolation and the loneliness and the changes that happened to young people in terms of their routines in schools and university closures, sports, art class, everything that they used to help them cope got shut down. But the kids' help phone was there. And I guess maybe that's why we're doing it today, this on the Friday of Thanksgiving weekend. I think all Canadians are thankful for Kids Help Phone, and that this is just really a splendid way to finish this week. Ensemble, ces expériences ont laissé plusieurs incapables de connecter avec des enseignants, pères, amis et familles qui offraient normalement une source considérable de soutien. Avec l'absence de système de soutien habituel, certains enfants et jeunes font face à un risque accru de violence domestique ou d'abus à la maison et en ligne. It is, as the data here shows, that these stressful experiences have taken a serious toll on the mental health of all young people, including that increase in anxiety, depression, and loneliness. And I think that, when you think that even in 2020, Stats Canada reported a 20% decrease in the number of youth reporting excellent or good mental health. And during the pandemic, requests for help through Kids Help Phone spiked, with demand for your services increasing 130% even in 2020. So I think, and probably in 2020, we did kind of think this would be over soon. And so, I think, it's that is a alarming statistic, but it means that you have to have the resources you need to be able to meet that increased demand. And my word, hearing those statistics of how many people you've trained, how many people, not only as trained counselors, but as trained now volunteers who actually, I think the fact that they're trained, and we talked a little bit about that, that means that they're increasing the mental health literacy of their communities, being able to recognize somebody and be able to say helpful things, or to be able to help somebody navigate to professional help. Yeah, it is our responsibility to do this. And I think that, the role of government, the role of charities, the role of the private sector, that we all have to work together in really making sure that people are getting the most appropriate care in the most appropriate place at the most appropriate time by the most appropriate provider. So today, we are here to just try and add a little bit more to the resources that you have to achieve that, what you need in equity. And so I'm not sure that we need the drum roll, but there is, this is an additional $3 million to Kids Help Phone for your exciting project that will boost the mental health support for young people in the underserved communities across Canada, and the oversubscribed in terms of the people calling you, that is with including the Indigenous and Black and newcomer communities. As part of this, I'm really excited about being able to expand its Counselor in the Classroom program. I really think this is so important that people can't seek help if they don't know it's there. And so I just think that this is hugely important. And I know we'll hear a little bit about expanding your Weaving Threads program to promote mental wellness around young people, currently just to Indigenous youth in Ontario, but that you'll be able to expand that, Deanna, across Canada, as well as adapted to the needs that are very different across Canada, coast to coast to coast. And also, I think for to be able to really understand that the needs of the Black community are different, and that they actually want that kind of specialized service that Tara's going to be able to explain to us. So I believe by investing in organizations with the proven track record, I think that we know we want to fund what works. And frankly, as we have heard from a lot of people, including Kids Help Phone on the front lines, we could stop doing some things that don't work with your help. So that for us to take the resources and move them to the things where we have proven results. And I think there's, as we develop the Canada Mental Health Transfer, that this is going to be really important to be really engaging with the people on the front lines to make sure that there's transparency and accountability for the dollars that will be sent to provinces and territories. So it is a huge, lifeline, and that it's just so impressive in terms of the quality, the immediacy, and the foundation of being able to help people on a good path. And I think that we want all kids across Canada to know that first difficult step of asking for help is the first step towards healing, and towards making sure that healthy choices come, and that the healing begins. So I hope that the funding that we're doing today helps many more kids take that first step because they feel it's a safe place. And I just think that in my Thanksgiving, I think we will all be thankful for Kids Help Phone. And I remember Dr. Peter Lynn once Thanksgiving weekend talked about how Thanksgiving is something we should all do, as opposed to the pursuit of happiness. I think that Thanksgiving is I think a much more nourishing sentiment, and I think I'm just thankful for Kids Help Phone. Thank you.
Well, there might not have been a drum roll, but I just thank you very much, Minister and Health Canada, for this. I have to say, yeah, I love that. Thanks and giving. There is some action in there. You have always had vision and commitment and strive for impact in the space of virtual care and mental health, and that's where Kids Help Phone comes together. And we know the need has never been greater, and the Government of Canada has never wavered in supporting Kids Help Phone. So this investment in mental health equity will ensure that we don't let our young people down, and we won't leave anyone behind. It's more important now than ever. So thank you, thank you, thank you for that. It's my great pleasure to introduce Deanna Dunham. She is our Director of Indigenous Initiatives and Equity Programs here at Kids Help Phone. She is also the founding staff member, our only staff member, I think it was 4.5 or 5 years ago, to our Indigenous Initiatives program, the founder of our Indigenous Advisory Council and of our Finding Hope Kids Help Phone's action plan for Indigenous youth. So it's my humble honor to introduce you all to Deanna Dunham, and please come to the podium, my friend.
There you go. Thank you. Thank you. Also, as a Haudenosaunee woman, I appreciated those comments. Every First Nations, Inuit, and Métis community from coast to coast to coast is unique. They're unique in culture and language, but also in connectivity, in the way they communicate, and in the way and in their ability to access mental health services. For this reason, Kids Help Phone offers 2 Indigenous programs that were designed and are delivered by Indigenous people for Indigenous people. So I'm talking about Brighter Days, an Indigenous wellness program supported by Sun Life, and Weaving Threads, an Indigenous engagement program. Weaving Threads is a network of volunteers in Indigenous communities who work with us in a variety of ways. One of the ways they work with us is to help connect young people in their communities with wellness resources, which include Kids Help Phone, but also include other resources that they can access. Now, Brighter Days is a virtual program that partners with Indigenous influencers like Notorious Cree and Mary Black and Sherry McKay. And it involves an Indigenous wellness specialist, a Kids Help Phone Indigenous wellness specialist, having a virtual conversation with groups of Indigenous youth. These youth are 6 years old up through post-secondary age. It's delivered in schools, it's delivered in community groups, and soon youth will be able to participate individually. So it's a program that really helps encourage those help-seeking behaviors. So it helps kids, recognize what is mental health and how can Kids Help Phone support us. And then it goes into different mental health topics to help youth learn coping strategies on managing anxiety and understanding abuse. And we'll be developing new modules on grief and online safety and all these different topics. So it improves the literacy, that mental health literacy, and it gets to children where they are in the way that they need it most. And like I said, it's delivered by Indigenous people, designed by Indigenous people, and delivered to Indigenous people. With the support of the Government of Canada, we're able to scale both of these programs. So we're tremendously grateful for that. Both of these programs honor and respect the distinctiveness of First Nations, Inuit, and Métis communities. And it supports young people in the ways that they choose to be supported without leaving home. So thank you, Yawa. And
thank you so much, Deanna. And now Tamar started here at Kids Help Phone and One as a frontline counselor, enabling us to scale in incredible ways in our texting service, courageously leading us in building Rise Up for Black youth in the midst of a pandemic. It's also humbling for me to introduce you, Tamar, as our manager of Black youth initiatives.
Hi, everyone. Thank you so much. I'm really excited to be here. I'm really excited to talk about some of the programs that we're doing at Kids Help Phone and specifically for equity deserving groups. So what is so special, but also very critical about the ways that we develop and that we deliver programs and services here at Kids Help Phone is the way that we center young people and their communities in this work. Youth are at the center of all of our programs, and we gather their feedback and their insights through direct contact, but also through our incredible wealth of data. Of course, this is also informed in no small part by our amazing advisory council. So our Black Advisory Council, our Indigenous Advisory Council, and our newly formed newcomer committee. It's important for us as an organization to meet young people where they're at. And to be able to maximize equitable access to culturally based supports across Canada. So through Rise Up, powered by Kids Help Phone, we listened to Black youth and their communities, the people that care about them. We're able to understand and hear more about the barriers that they face and get their recommendations about how to overcome those barriers and those obstacles. We do this through the way that we provide service. We do this by informing and educating our Kids Help Phone from our frontline staff all the way up through our executive and boards about Black culture and how Black people exist in Canada. We also do this through community and school-based programs, such as a counselor in the classroom, to help reduce stigma and promote help-seeking behavior early on. We also provide frontline support through our professional phone counseling and through our texting volunteers who provide layers of safety and crisis support, but also that make a huge community impact. We've trained over 7,000 volunteers from very diverse backgrounds. People are 18 and over. They come to us as students or as teachers or as mental health professionals themselves, and they're able to bring those diverse experiences, all of their knowledge that they've gained through our training back to their communities. So they're able to talk easily about things like suicide or things like depression and ask those hard questions and support their friends, their family, their neighbors, the people who are important to them in the spaces that they're in. Young people in their communities can also access a vast array of content and interactives through our gateway for e-mental health solutions. So that's kidshelpphone.ca, and you can go there and visit to support young people from equity deserving groups. Thank you so much.
Thank you so much. I hope you all got a sliver of the work that happens at Kids Help Phone. And again, Minister, thank you so much. I will give the podium up reluctantly to Dominic from Health Canada to moderate any questions from media that might be there.
We will now proceed to questions from journalists in the room. Please state your name, media outlet, and whom your question is directed to. You'll have the opportunity to ask one question with one follow-up. Let's proceed to the first question. Nous allons maintenant passer aux questions des journalistes présents dans la salle. Veuillez indiquer votre nom, votre média et le destinataire de votre question. Vous aurez la possibilité de poser une question avec un suivi. Nous allons passer à la première question. We don't have any questions in the room. We're going to head over to the Zoom online moderator.
We'll now proceed to questions from journalists on Zoom. If you are a reporter and wish to ask a question, please use the hand raising function. We ask that you limit yourself to one question and one follow-up. Unless I have stated it, please indicate your name and media outlet before your question. Nous allons maintenant prendre des questions des journalistes sur le Zoom. Si vous êtes journaliste et vous désirez une question, veuillez utiliser l'option de lever la main. Vous vous limitez à une question et une question suivie. Si je ne l'ai pas dit, veuillez identifier votre nom et votre média avant de poser votre question. So we have no questions on Zoom. So back to you, Dominic.
They were so clear. It was so good. It's so good. That's right.
So that's a wrap.
That's a
everyone.
wrap. Yeah, that's great.
we-
So
Thank you.
thank you.
We may
all.
have one question.
Oh, okay.
Well, it was explained very clearly, but I just wondered if we're new to the services that are provided, if someone could just clarify what exactly the $3 million, I understand it's a program to expand the in-classroom counseling, is that correct? I'm just, and what kinds of things, like the need, I guess, for this in some of your communities, just to sort of clarify it a bit more, if you could.
I don't have the number of counselor in the classroom sessions, but I can tell you the 200 volunteers are included in the Weaving Threads program. So Weaving Threads right now is an Indigenous program and it's going to be expanded across country. But we're also developing versions of it that are designed and delivered by Black people and by newcomers. So they will have different names, but they're volunteer programs at the core. So there will be 200 volunteers for that. There are a number of Brighter Days sessions for young people. So that's the Indigenous program that I spoke about that is delivered in Indigenous communities. That's part of it. And Counselor in the Classroom, which is a program for all young people in Canada. And that is another program that encourages help-seeking behaviors and really helps build that youth literacy in classrooms across Canada. I'm not sure what I'm forgetting now.
Yeah, maybe if Kathy would just explain the way Kids Help Phone is funded and the other money that comes from the federal government. This 3 million came out of 100 million that was in the 2021 budget that was to help the communities most affected by COVID and underserved and all. So this was out of that 100 million, 3 million went to Kids Help Phone to work on the equity piece of people underserved or with greater needs as we learn from their data. But maybe Kathy.
Yeah. And just to put some clarity on that, we have some of these programs in what we'll call pilot, where we launch them and we learn from them. We co-created with people in communities. Rise Up is a great example of that with Black youth. Our job now is to scale this through technology, through more clinicians to be able to support the program and scale it across the country, anchored on where funding already comes from the government and other sources, which is our clinical operations. So our more than 300 clinicians already on staff, we're going to launch these programs on top of that work. So it's about scalability, technology, people, and awareness. There's a lot of work we're going to do in awareness in these communities very specifically. So with this funding, we're able to do this nationally.
And just face it, it's a phone line and a text line, and they can text rather. Is that how they get in touch with you? Yeah.
We have multiple products or levels of service. So no one entry into Kids Help Phone is the wrong entry. You could ladder all the way up to a professional counselor, texting, live chat, move into self-directed tools, our gateway, peer-to-peer. So and therefore these programs layer into this ecosystem for Kids Help Phone. So there's many, many ways for young people to get service. And what this funding will do is bring equity to communities across the country as well.
And one last question, if I could.
Let me just, we also have the Wellness Together Canada platform, as well as the Pocket Well app. And Kids Help Phone is a partner in that consortium. So they actually, sometimes if people go to another place like Wellness Together or Pocket Well, if they need help, they will be navigated to the Kids Help Phone. So that was stood up also in the spring of 2020. But again, Kids Help Phone was part of that consortium.
If I could just ask, coming out of the pandemic, of course, children were really affected, although many of them isolated, working at home in different scenarios. I mean, now children are back in school in Ontario for the most part. I mean, what is the need out there in terms of what the supports? Has it changed? Is it getting a little better now that they're socializing a bit more? Or is there more anxiety? I mean, is there any way you can?
Yeah, thank you for that question. It's a very important question to ask. What we have seen over the years, without a doubt, our data, our clinicians, is when young people experience trauma, first of all, trauma doesn't end when that moment happens, and they've learned help-seeking behavior. So our volumes go up, or we spike, and they stay up because young people are continuing to, and that's a silver lining. The impact of COVID, we're still in the middle of it. And I will be bold and say the tail end of COVID will be in mental health. We are not anticipating a reduction in need for service. In fact, just the opposite. As people are grappling with whatever new normal is, their mental health has been impacted. Young people lost milestones in their lives that are really important to foundational tools in their tool belt for approaching adulthood as well. So we anticipate greater need rather than less need.
And I would just say that as they go back into the classroom or back into other areas, the racial discrimination and it's not going away, and the bullying and the kinds of things that whether it's the 2S LGBTQIA community that in person, it they may well have been protected from that in their own homes or only in their own neighborhoods, and so they're back in school, and I will see what the data shows, but I do think that this issue of equity and people feeling safe, and being able to report things that, or at least talk to somebody about something, it just doesn't seem fair. In that sort of justice is going to be hugely important, I think, as we, it's like my youth council always says to me, we don't want to go back to normal. We want to leap forward into something better. And I think that these kinds of equity seeking approaches really will help us address the ongoing racism and discrimination that these young people are facing all the time.
Can I just have one more? Is it teens who are most affected? Or, I mean, is there an age group? I mean, we talk about bullying. We hear a lot of the teenagers are, the peer groups. Last question, but I just wonder if you could answer that quickly for me.
I think there's no boundaries to mental health and the challenges young people face with mental health. A typical day for Kids Help Phone is as young as 5, all the way through to about 29. That's an everyday thing, and no problem too small, no problem too big. Across the gamut there. So
you were saying that some of the suicidal ideation is really alarming.
Very young. We are seeing suicide ideation at younger ages in groups, young girls, young boys. No one is immune to this as a young person right now with the mental health. I don't think we can minimize the trauma of COVID, and that will be not finished with in this generation.
And I think what you were saying about cyberbullying or the kinds of group chats, the kinds of things that can be very unhealthy. And I think even in some of the Indigenous communities, say in Saskatchewan, even though the communities are at a distance, the group chat is together and with some very deadly outcomes.
And I just have one more thing, and then to you. One question and 53 answers. But I just also want to comment that this is a really tough world that young people are consuming right now in real time. on whatever gadgets they have. They are seeing war. They are seeing tragedy, like at the James Smith Cree Nation right in our own country. That, in the midst of what we've all gone through, just require us to be more than present more than ever. Over to you.
I was going to bring forward a silver lining that
Yes.
that Minister Bennett brought forward before, because you mentioned having that literacy and people reaching out for support maybe more now, because we've been talking more about mental health. Like COVID has brought mental health to light for a lot of people. So we're having people who are first questioning for the first time, what is mental wellness? And so those people who are really just being introduced to the topic of mental wellness are recognizing their own challenges and reaching out for support at the same time. So I think we're seeing growth in our service use in a positive way, that people are reaching out now who maybe wouldn't have reached out before because they didn't feel welcome to do so.
That concludes today's event. Thank you. Ceci conclut l'enregistrement aujourd'hui. Merci.